Hey there YouTube, I'm going to talk to you again about healthcare reform. I'm going to talk to you specifically again about the public mandate before I use the illustration of the emergency room and how that works and how, because of how the emergency room works, we should have a public mandate. As a small recap, I said that emergency rooms treat you before they bill you, so people who don't have insurance end up getting treated in emergency rooms, but they get treated for very chronic and end-stage illnesses that cost a lot of money. These same people who can't afford health insurance can't afford to pay their emergency room bill anyways, so the state picks up the bill, and you as a taxpayer ends up picking up their bill. So regardless of whether or not someone chooses to have insurance, they will get some sort of end-stage coverage for the disease, which may not be completely what they need, but will end up paying for it as a society because of that. So I think we should have a public mandate to cover them on the front end before their disease gets very advanced. So another reason, though, that was my last video. The second reason that I'm going to talk to you right now is about health insurance companies. Well, right now, both Republicans and Democrats agree on something in healthcare reform, and that is we want to stop health insurance companies from being able to deny you coverage based on a pre-existing condition. So if you have cancer, you can still get affordable coverage with a health insurance provider. Now, Republicans and Democrats both agree on this, but of course they don't both agree on the public mandate idea. Now, I think the two go hand in hand, necessarily, based on how the economics of this idea would work. So, if you make a health insurance company provide you with coverage, even if you have a pre-existing condition, as a smart consumer, what would you do? Well, you would wait until you're sick to get coverage, because a health insurance company can't stop you from getting coverage. So if we enact this law without a public mandate, everyone's just going to drop their coverage and just get it when they need it. Because of that, if the people are just getting it when they need it, more money is going to be coming out of the system than going in, and that'll just collapse our health insurance companies. So if you're going to do something which both Republicans and Democrats want to do, which is force insurance companies to provide you coverage because of a pre-existing condition, which of course I think we're required to do this because of morality and justice and human rights and that sort of thing. We shouldn't let people die because they're sick. We should provide them a way to get health insurance, health coverage that's affordable and within their means. If you're going to do that, you've got to have a public mandate to have health insurance, or else the whole system's going to collapse, because people will just not have their health insurance until they need it. So we're just going to have a health insurance of sick people, which is just going to collapse it. Now, if you're going to force everyone to get health insurance, right, you got to make this somehow affordable. Okay, well, competition isn't doing it right now. Competition with the free market, with private industry, is not making health insurance affordable. So one thing we can do to make health insurance as affordable as possible, to make this public mandate as small of a burden as possible, is the public option. Yes, it might not have the same quality as some health insurance companies out there. It probably going to have better qualities than some of the other health insurance companies out there. I'm sure if you know, the private industry has a wide range of quality of care. I'm sure it'll go right somewhere in the middle about quality of care for your money. But it will not have advertising costs, it won't have administration costs, it won't have that overhead costs that private insurance companies have. So it'll be as cheap as possible. So it'll make the burden as small as possible for those who can't afford higher quality coverage if they want it. Okay, because otherwise our economy is pretty down in the dumps as it is, and if we force people to buy coverage that they can't afford, well, we're going to get even more bankruptcies, and our economy is going to go more through the tubes. So in summary, this is kind of a logical flow of arguments. If you have one, you need the other, and if you have this, you need the other. So if we're going to force health insurance companies to provide you with coverage, even if you're sick, we got to force everyone to get coverage. And with this economy, if we force everyone to get coverage, we got to provide them with a cheap option, or public option. This is actually exactly why during Obama, in his speech, he said, I don't want a public option for the sake of the public option. The public option is a means to an end. in the end being a cheap option that costs little. He goes, if we can arrive at that end with any other way, he's okay with that. And I'm pretty okay with that too. But we're trying to get affordable coverage. And the best idea we have so far is the public option, because the options we have right now aren't affordable enough. So I hope that helps give another reason why we should have both a public mandate and a public option, besides how emergency rooms work. I'm going to make another video based on encouraging health as opposed to encouraging procedures, which is another idea we're talking about a lot in health insurance reform, and I think that'll be my third video. I hope this helps. Thanks.